Immune. The biological mechanism for identifying and destroying pathogens within a larger organism is what is known as immunity. Pathogens are agents that cause disease, and these include bacteria, viruses, fungi, worms, etc. Resistance or protection to infectious diseases is mediated by immune system. The immune system is a host defense system comprising many structure and biological systems that function to defend against infectious microbes. And this immune system includes the lymphatic system, the primary lymphoid organs, the secondary lymphoid organs, the immune cells. All this combine together to form the immune system. In the same way, this results in toxicity or toxic effects, which are local or systemic. The microbes usually produce toxic substances, and this toxic substance might be either of local effect or systemic effect based on where these microbes are present. Immunology is the study of the components and function of the immune system. Immune system, molecules, cells, tissues and organs which provide non-specific and specific protection against microorganisms, microbial toxins, tumor cells. It's very crucial to human survival. And specific and non-specific. Non-specific is innate immunity, whereas specific protection, this is rendered by the antibodies. The immune response and immunity. Immune response, it is innate as well as adaptive. Innate is non-specific, adaptive is specific, primary is there, secondary is there. Immunity, state of non-specific and specific protection, both together you can call it as immunity. And acquisition is by two methods. It is either naturally, when a person naturally encounters with a disease, virus, and if he gets immunity, then that you call it as natural. Artificial is the one that we are inducing through immunization. Active antigens enter body naturally with response of innate and adaptive immune systems, provides long-term protection. Passive antibodies pass from mother to fetus across placenta, infant in breast milk, provides immediate short-term protection. Artificially acquired immunity. Active one, antigens enter body through vaccination with response of innate and adaptive immune systems, provide long-term protection. Passive one, antibodies from immune individuals injected into body, referred to as immune serum globulins. Immune globulins and gamma globulins. These provide immediate short-term protection. And principal function of the immune system: to protect humans from pathogenic microorganisms, pathogenic microorganism causing infection or disease, ability of pathogen to enter host, multiply and stimulate at an immune response. Clinical manifestations associated with infection which results in disease. So all these three are protected because of this immune response. So this is how innate immunity works. Microbes, they are protected by an epithelial, and they are prevented from entering into body by epithelial barriers, and once they enter, phagocytotic process takes place where these entered microbes are killed. The complement system also acts here, as well as natural killer cells. The T lymphocytes play a major role here, and the T cells function, or it could be through the B lymphocytic system, where antibodies are produced and the antigens are killed. So two types of immunity works. We will see all these in detail. Innate immunity is also known as native immunity. It's resistance to infections that an individual possesses by virtue of his or her genetic and constitutional makeup. It's not affected by prior contact with microorganisms or immunization. Whatever immune response a person has from birth. There are many factors that influences, but that immunity remains throughout, and that immunity is known as native immunity. It may be specific, particular to specific pathogen, or non-specific, where it indicates a degree of resistance to infections in general. And innate immunity is mediated by cells and proteins that are always present and ready to fight against microbes. Hence they are known as innate and are called into action immediately in response to infection. Anatomic barriers are there: skin, mucous membrane. Physiological barriers are temperature, pH. Phagocytic barriers are there. Then you have the inflammatory barriers: redness, swelling, heat and pain. We'll see each one of it in detail. And there are factors influencing the level of innate immunity. One is age. Very old and very young are more susceptible to infectious disease. You know, children they are most prone to such diseases. Every time up to the age of 8 they are more susceptible. Once an infection or once a virus attack comes, their body succumbs easily to disease. This is because of less immunity within a very young age. And the same is the case of very old person. They are also more susceptible to diseases. Hepatitis B virus infection is asymptomatic in newborn, as it lacks developed immune mechanism to express the disease. Most of the conditions a person expresses: when you get a fever, when your throat pains, when you keep on sneezing, all these are some mechanism the body adapts to prevent entry. Body takes in to prevent the entry of these microbes. So these are all visible symptoms of a disease. But since a kid or a newborn, the immune system is not that developed, what happens is there is no symptoms. It is asymptomatic. There is no visible symptoms because his or her body is not responding to the antigens that are present. Hormones also influence endocrine disorders such as diabetes mellitus, hypothyroidism and adrenal dysfunctions. These all enhance susceptibility to infection. This lowers your immune response, as well as increase corticosteroids. This also decreases anti-inflammatory effect. Nutrition is also one of the factor for immune response. In people with malnutrition, the immune response is reduced. And line of defense: first line of defense and second line of defense. First line of defense, you have an intact skin, mucosa, prevent entry of microorganisms. That is, every person has this first line of defense. The second line of defense, that is antimicrobial proteins, phagocytes and other cells, that depends on your hormone, your hereditary, your age. It depends upon different factors. Mechanism of innate immunity: epithelial surfaces, antibacterial substances in blood and tissues, microbial antagonism, cellular factor in innate immunity, inflammation, fever, acute phase. So this is how your body works. We'll see all this in detail. This is a summarized picture. Removal of particles including microorganism. Once it enters the nasal cavity, once it comes out, if the foreign particle is within eyes, it comes out as tear. Then skin is a physical barrier. The pH change in the stomach, that is also a barrier. Flushing of urinary tract prevents colonization. Normal flora compete with pathogens. Again, some flora is within our intestine, and that is considered as a useful intestine. This flora should not be destroyed by the microorganisms or pathogens. So there also a competition is there between the pathogens as well as the normal flora. And the pH difference in the stomach, that also plays a major role. The mucus and phagocytes present in lungs, all this together are part of chemical and physical defense mechanism of our body. The structural integrity of tissue surfaces, barrier to penetration by microbes. Intact surfaces prevent potential pathogens from adhering to surfaces. Growing at these sites, such as they do not travel elsewhere in the body, colonization is there of the microbes within the skin, but the colonization is prevented by the sweat glands and all that are present on underneath our skin. Damaged surfaces, abraded skin are often readily colonized, promoting invasion of this and other tissues. The mucosa of respiratory tract has several innate mechanisms of defense. The structure of nose, it prevents entry of microorganisms to a large extent, the inhaled particles being arrested at or near nasal orifices. Those that pass beyond are helped by mucous lining of the epithelium and are swept back to mouth, where they tend to be swallowed or coughed out. The cough reflex is an important defense mechanism. The cilia on the respiratory epithelial cells propel particles upwards. Nasal and respiratory secretions, they contain substances that combine with influenza and some other viruses. Particles that manage to reach alveoli, they are ingested by alveolar macrophages. Macrophages are present. They they undergo phagocytosis to kill these pathogens. The mouth is continuously bathed by saliva, which has inhibitory effect on many microorganisms. And particles deposited in the mouth, they are either swallowed and subjected to action of digestive juices and high acidity of stomach. The intestinal mucosa is covered by lace-like network of mucus. Particles get trapped in this mucus and form small masses, which are propelled by peristalsis. The conjunctiva is freed of foreign particles by flushing action of lacrimal secretions. When a particle enters our eyes, you feel irritated, and that irritation that is felt by flushing action of lacrimal secretions. The eye becomes susceptible to infection when lacrimal secretions are absent. And tears can contain antibacterial substance which is known as lysozyme, which acts on cell walls of susceptible bacteria. Epithelial surfaces, mouth, saliva, digestive juices, high acidity of stomach. Conjunctiva, what comes into conjunctiva? Flushing action of lacrimal secretions. There you have the lysozyme, thermolyable one, which has a basic protein, and lysosomal macromolecules are also present. It acts by splitting certain polysaccharide components of cell wall and non-pathogenic bacteria. Urine is also, there is a flushing action, bacteria from urethra. Spermine and zinc, which shows antibacterial activity, as well as acidity of adult vagina, which is inhospitable to many pathogens. The skin microorganisms normally associated with skin prevent potential pathogens from colonizing. There is sebaceous gland secretions, fatty acids and lactic acid, which lower the skin pH. They keep it at around 4 to 6, which is not favorable for microorganism. But unbroken skin is a contiguous barrier for these microbes, and the skin has a low moisture content. Ciliated epithelial cells lining the trachea remove microbes inhaled through the nose and mouth. Mucus secreted by these cells prevent the microbes from associating too closely with the cells. The cilia push microbes upwards until they are caught in oral secretions and expectorated, or they are either swallowed. This is the normal flora of the gastrointestinal tract, where the pH changes. pH is 2, from the intestine it is pH is 4 to 5, and large intestine the pH is 7. This again kills most of the bacteria. The pH of stomach is 2, pathogens, and 2 is highly acidic for pathogens. The pathogens must compete with normal flora associated with small and large intestines, and microbes have a difficult time adapting to abrupt changes in pH as they might encounter as they pass through the gastrointestinal tract. Natural defense against the invasion of blood and tissues by microorganisms and other foreign particles is mediated to a large extent by phagocytic cells, which ingest and destroy them. The phagocytic cells are macrophages and neutrophils. Phagocytes reach the site of inflammation in large numbers. These is attracted by chemotactic substances and ingest particulate material. The microorganisms are more readily phagocytosed when trapped against a firm surface like alveolar wall than when they are free in tissue fluids. Bacteria are phagocytosed into a vacuole, and this condition is known as phagosome, with lysosomes to form phagolysosome. The bacteria are subjected to the action of the lytic enzymes in the phagolysosomes and are destroyed. Infection or injury leads to a sudden increase in the plasma concentration of certain proteins, collectively called acute phase proteins, and infections are studied by means of C-reactive protein, which is part of this acute phase proteins. And these C-reactive protein that is high when infection takes place because it is believed to enhance host resistance, prevent tissue injury, and promote repair of inflammation, non-specific reaction to stimuli such as toxins or pathogens. They are mediated by a subgroup of leukocytes. The leukocytes are white blood cells that produce cytokines that lead to fibrin clots at the site of inflammation. The inflammatory response results in redness, swelling, heat, and pain at the site of the infection. And most important outcome is the immobilization of the pathogen at the site of inflammation. Physical manifestations are abscess, which is localized collection of pus surrounded by a wall of inflammatory tissue, or surface localized. Then you have boils, which is also abscesses located in the deeper layers of the skin. You have ulcers, which are localized area of necrosis of the epithelial cells. These are all different types of inflammations that are formed. And inflammation can aid in host pathogenesis, since the inflammatory response can lead to damage of the host cells and tissues, creating a favorable environment for the invasion of a potential pathogen. Uncontrolled systemic inflammatory responses cause severe swelling and fever, where the systemic condition is a condition where the whole body, the pathogen has infested the whole body. Then you call it a systemic inflammatory response. And when this occurs, this leads in severe swelling at different parts of the body, plus fever is one of the main symptom. And usually this fever as well as swellings, these are responses which are not localized to one site. Normal body temperature, that is 37 degrees Celsius, and abnormal increase in the body temperature usually caused by infectious agent. Pathogenic bacteria like endotoxins from gram-negative bacteria. Some bacteria cause the release of endogenous pyrogens from the WBCs that kill them. Slight temperature increases boost the immune system by increasing the activity of phagocytic cells and antibody responses to pathogens. Strong fevers harm the host by damaging host tissues. And these strong fevers are a result of the toxins that are secreted by the microbes that enter into our body. Several substances having antibacterial properties are present naturally in blood. These include beta-lysine, which is thermostable stable substance active against anthrax and related bacilli, basic polypeptides, leucines from leukocytes and plaquins from platelets, lactic acid, muscle tissue and inflammatory zone, lactoperoxidase present in milk but concepts The concept is not still clear. What's the action of lactoperoxidase? Then you have interferons. These are activated against viral infections. Immunity. Acquired immunity. The resistance that human acquires during life is known as acquired immunity. It's also known as adaptive immunity. It's of two types: active resistance developed by an individual as a result of an antigenic stimulus; passive resistance that is transmitted to a recipient in a ready-made form. Active immunity, it involves the active functioning of host immune apparatus, synthesis of antibodies and production of immunologically active cells. It develops humoral and cellular immunity. On that we will learn later the humoral and cellular immunity. Latent period, it requires time for its activation. And once if you take a vaccine, maybe the response is after few days. That is what is known as latent period. A negative phase is there, a time period in which there is reduced measurable immunity. Antigen combines with pre-existing antibody and lower its circulation. Secondary response, if an individual previously exposed to antigen and exposed to the same antigen again, will respond quickly and abundantly, which is known as secondary response. It also associated with immunological memory, that is retain the memory of prior antigenic exposure. More effective and better protection than passive. Active immunity, natural one. Clinical or apparent infection by a microbe. Immunity is long lasting, but it varies on types of pathogen. Large majority of adult active immunity against polio virus. Lifelong immunity, which for viral diseases such as chickenpox or measles. And influenza recur after few months, not even few months, after few weeks maybe influenza recurs. It's due to lack of immunizing capacity of virus. The virus keeps on changing its size and also it's hard to find a specific vaccine against these influenza. Common cold, same clinical picture, which is caused by mostly all viruses. Even in the practical difficulty for immunization against the present coronavirus is also the same, because the immunizing capacity of virus, to immunize a virus or to contain a virus, that is hard. So even if you take a vaccine, you're not clear for how long you're protected from a virus. Immunity following bacterial infection is less permanent than virus. Prevention, immunity to reinfection lasts long till the disease remains active. Example is typhoid. Active immunity, artificial. Resistance induced by the vaccines. It may be either bacterial or viral vaccines which are taken as artificial ones, and in few cases booster dose may be given, that is repeated dose of vaccines following the primary vaccination, which prolongs the immunity. The vaccine, once it is taken, the immunity may not last for a long time. There you require a booster dose, and again after some time you are taking it, and if you take it for 2 or 3 times at interval of say few months, then this becomes a permanent immune response. So that is known as booster dose. And for hepatitis B and all, we have a booster dose. And active immunity, artificial one, the vaccines may be in the form of live ones, the killed one, or the bacterial products. They are present in the vaccines. Active immunity, artificial one, the live vaccines. Live vaccines, here microbes that virulent, they are made non-virulent or inactive. They are made inactive and they are part of this vaccine. It initiates the infection without causing any injury and disease because it is made into non-virulent form. The thing is, it is only live microbes, but it is ineffective. It's not that effective like a virulent microbe. It parallels with natural but of lower grade. Administered orally like the Sabin vaccine for poliomyelitis and measles also it is there. Killed vaccines. If the microbes are killed, heat killed, there are different methods of killing a microbe. In all the vaccines, the microbes are present either live condition or killed condition. So here it is the killed vaccines where it is comparatively less immunogenic because the whole organism is there, but the thing is, it is killed microbe, and protection lasts only for a short period when compared to a live one. They have to be supplemented by booster dose repeatedly. May be given orally, but this route is not preferred. And parenteral administration is through humoral antibody response improved by the addition of adjuvants to these vaccines. Passive immunity, which is a natural one, passively transferred from mother to baby, transmitted predominantly through placenta in humans, and some of immunoglobulins A, which is immunoglobulin alpha antibodies in neonates, human colostrum. In human colostrum, IgA is present, and human fetus ability to synthesize IgM from 20th week of life, but overall immunological capacity is still weak. Some part of immunological independence develops only after 3 months. Till then, maternal antibody gives passive immunity. And, infection in children is common after age of 3 months than neonates. Because till that neonate age, it is the mother's immunoglobulin that works. Active immunization of mother during pregnancy improves the quality of passive immunity in infants. Tetanus toxoid is recommended during pregnancy. Artificial passive one, resistance is passively transferred to a recipient by the administration of antibodies. Used as prophylaxis and therapy, it's indicated for immediate and temporary protection in a non-immune host faced with the threat of infection. Insufficient time for activation for active immunity. If you need something immediately, if you need to act immediately and you cannot wait for the immune system to act, then you go for passive artificial immunity. Treatment of some infections and suppression of active immunity during the time of injury and all, that is done through this pathway. Rh immunoglobulin during delivery for prevention of immune response. Rhesus factor in Rh negative women with Rh positive babies. This we learn detailed during erythroblastosis fetalis. The agents used for this: hyperimmune sera of animal or human origin, convalescent sera or pooled human gamma globulin. Hyperimmune sera, antitetanus serum derived hyperimmunized equine, which is horse. It's a temporary protection, hypersensitivity and immune elimination. Human hyperimmune globulin, which is tetanus immune globulin, free from complication and comparatively long lasting. Anti-sera of animal origin is indicated only where human sera is not available. Anti-gas gangrene, anti-botulinum sera and anti-venoms. Convalescent sera, sera from patient recovering from illness or high level of specific antibodies. Once a person is succumbed to a disease, what happens is his body starts to produce antibodies in larger number. And if you collect and once the infection is over, still for a day or two, the production of antibody is high. So if you collect the blood from a person who is already infected, that means he will be having high antibody. This high level of specific antibodies is known as convalescent sera. This serum is known as convalescent sera, which is given to a person as artificial passive immunity. And pooled human gamma globulin. Pooled sera from healthy individual contains pathogen prevalent in the region. And these were used extensively in the past for viral hepatitis A and immunodeficiency disorders. And there are many disadvantages for use of these passive artificial immunity, because it is not synthesized in your body, so it's a foreign particle. Whatever it be, it's a foreign particle in your body. So this results in anaphylactic reaction due to complement activation. So it's only given intramuscularly, and chances of getting bloodborne infection like hepatitis B, hepatitis C, HIV and other infective agent is high during this passive artificial immunity. Combined immunization is combination of active and passive immunity, that is immediate protection, for which passive is also used along with active. TIG in one arm and tetanus toxoid injection in another, followed by full course of tetanus toxoid. This TIG provides necessary protection till active immunization is able to take. Local immunity, this concept is given by Bestredka. It refers to protection given to potential site of entry of pathogen, prevents the entry of pathogen. Immunoglobulins, namely IgA, is involved, produced by plasma cells present on mucosal surface. And live vaccines for poliomyelitis augment the resistance at the level of gut mucosa, which is the site of entry of polio virus. So local one, so that can prevent the entry through a local point. Herd immunity. You might have heard about this herd immunity now, because this is the most relevant in this time of corona. Overall level of immunity in a community. It's noted that we require herd immunity to prevent this coronavirus. 80% of individual in a population relevant in control of epidemic diseases. When herd immunity is low, this results in epidemic condition. So if your community is having a very good immunity, means the resistance of people against this microbe will be high. That is what we are trying. We are trying to build up the vaccination program in India. This boosts up our immunity in India. So that is a type of herd immunity where all the citizens are immunized, so that once the microbes are still there, the community is able to fight against the microbes. So this is what is happening. We have two types of immunity: acquired immunity, innate immunity. Acquired immunity is further divided into active immunity, which is natural one, and which is artificial one. The passive one also, it has an natural one as well as an artificial or induced one. Innate immunity: external defenses, skin, mucosa membrane, secretions, and internal phagocytic cells, antimicrobial proteins, inflammatory response, as well as natural killer cells. The acquired one: humoral response, that is by means of antibodies, and cell-mediated response, which is by means of cytotoxic lymphocytes. Anyway, all the system acts against microbes or pathogens.